Go
Can
ahead,
I
sir.
get my slide? Yeah. Good afternoon, everyone. My name is Dr. Prasanta Kumar Nayak. I am a consultant and fertility specialist and clinical head at Oasis Fertility Hospital, Bhubaneswar. So today we'll just discuss about a, specific procedure in the practice of infertility or in the management of infertility patients, especially related to IVF and ICSI procedures. That is called pre-implantation genetic testing. So, as the name says, that it is something that before the embryo is being transferred into the endometrial cavity of the woman, usually we do some testing in the cells of the embryo. That is a kind of genetic testing. So, what is this pre-implantation genetic testing? Why it is being done, and what is its advantage and disadvantage, and who are the candidates that they should take this facility? We'll discuss in little details and little briefly, and so in next 20 to 30 minutes, we'll just cover it. So, if you'll ask me that what is PGT and how it is being done, then as per the definition says that pre-implantation genetic testing is the process of screening embryos that is produced during in vitro fertilization technique or IVF for genetic diseases. That is a testing which is being done for genetic diseases and for chromosomal diseases before they are being transferred into the woman's uterus. So PGTs thus gives accurate information about the embryo's health and helps you to choose the best embryo. That means all the embryos what we make inside the laboratory in the process of IVF or ICSI may not be competent enough or may not be normal so far as the genetic is concerned. Some may be abnormal in the genetic side. So once we do this testing for pre-implantation genetic testing, we can choose which one is the good embryo. That means without having any genetic abnormality, and that one we can transfer to have a healthy child. Well, so this PGT is being means known as either PGTA or PGTSR or PGTM. PGTA means pre-implantation genetic testing aneuploidy. So this is a kind of pre-implantation genetic testing which is being done in certain conditions where we suspect high chance of aneuploidy or we want to avoid the possibility of aneuploidy in the baby or in the newborn. So in such situations, this kind of genetic testing is done. And PGTSR, that means it is a kind of genetic testing where if you suspect there is some structural rearrangement defect in the embryo, so it can be diagnosed so that we can prevent further means adverse consequences of it, like unbalanced translocations or inversions, which are mostly result in form of repeated abortions or early pregnancy losses and all these things. So another condition called PGTM or pre-implantation genetic testing or monogenic defects. So this kind of testing is being done where we suspect or where there is a chance of monogenic disorders. There is a chance this kind of genetic disorder might be transferred from the parents, from either from the mother or father or both, to their offspring, so that the offspring will become a means will suffer from that disease. So I've heard such kind of disease in the offspring. This test is done, especially in conditions like you may tell thalassemia, sickle cell disease, all these cystic fibrosis, and so many other medical means this genetic disorders that we'll discuss further. And so if you'll see that, uh, yeah, yeah, if you'll see that this kind of test, what we are doing nowadays has different kind of genetic testing modalities or techniques that usually we follow. So which may be a simple a fish technique, or it can be a CCS technique, or it can be a NGS technique. So there are different types of laboratory techniques which are being followed to diagnose such kinds of genetic disorders in the embryos. And out of these different kind of testing facilities, usually the next generation sequencing or the NGS technique for free implantation genetic screening is supposed to be the best at the present context, because it has the ability to precisely detect even the mosaicism. That means there are some embryos which may contain genetic disease partially and healthy cells partially. That is a kind of mosaic condition. And it also NGS techniques also diagnose the segmental mutation, and it has the capability of concomitant PGT and PGTM testing simultaneously. So this is the advanced technique which is nowadays most of the labs are following. And usually we choose our labs based on the which platform they are using for this genetic testing. Then if you'll see that already I discussed about PGTA, SR&A, then what are the indications of doing PGTA? So the PGT aneuploidy testing is being done mostly if the age of the mother is more than 35 years. That means she's an elderly mother. Have the chance of getting aneuploid fetus is more. And also those women who have already suffered 2 or more miscarriages, they are having repeated abortions. And also in women who have 2 or more failed in vitro fertilization, means IVF failure cases. And some conditions, the couples who experienced an altered number of chromosomal during their previous pregnancy, couples who are carriers of numerical abnormalities in the sex chromosomes, there are some of the rare conditions where we can also use. But what is the purpose of doing this PGTA? It is only to reduce early miscarriage rate and time to time pregnancy, and to improve the live birth rate, of course, because ultimately we want a healthy and live fetus to come to the couple. So by decreasing the number of embryo being transferred, so multiple pregnancy chance is also being reduced in this by following these methods. And if we to come to the indications of PGTM, it is being practiced in conditions where the couple, either of the couple or both couples are carriers or suffering from thalassemia, hemophilia, cystic fibrosis, spinal muscular atrophy, Duchenne muscular dystrophy, and various hereditary cancers syndromes involved by BRCA1 and BRCA2 gene, like breast cancer, colorectal cancer, and other cancers. Where if you are diagnosing this PGT by these genes in the offspring, in the fetus, in the embryo, before it is being implanted, so we can avoid transferring such disease carrying or genetic disease carrying embryos. So PGTM is being considered in such situations. Similarly, here we should go for PGT Asia and all. So another specific, very specific condition here, the PGTM has a very some crucial role. There is a terminology called Xavier sibling. There are some conditions here the IVF helps in getting HLA matching sibling, because already the couple has a child who is suffering from some disease for which he needs or she needs bone marrow transplant from any of his relatives. But in transplantation, HLA matching is very, very important, because if it is not matching, it will got rejected, because any transplanted tissue in foreign tissue in another person's body get rejected. But if you are giving a exact HLA matching tissue, then it will accept and it will help. Such situations, the PGTM is being done to choose that HLA matching gene containing embryo, and that embryo is being means transferred to the mother's womb to have a child which is healthy and HLA matching to the diseased child, so that he or she can donate his bone marrow to the existing the diseased child, so that it will rescue him. It has come as a savior for that already existing child. So that is called savior sibling. So if you ask me that whether PGT technology can detect all types of chromosomal or genetic aberrations, means is it for all kinds of genetic diseases? But the answer is no. It cannot be used, means like all microdeletions or microduplications to diagnose. Similarly, in diagnosis of single gene diseases at once, it cannot, all single gene diseases cannot be diagnosed. And mitochondrial DNA analysis, detection of uniparental disomy, detection of imprinting disorders. There are some other various other genetic disorders which are may not be very important, or the incidence are not very high. But there is also no technique till date which can detect such situations, as you can see in the screen. Similarly, another question might be coming to your mind, that whether there is any contraindication of this PGT, means preimplantation genetic testing. Yes, there are so many contraindications, like it cannot be provided to just to pick those embryos having a skin color, fair skin. They want just fair skin child. They want a very tall height child or some good appearance. All those things just to have the impression, you cannot use the PGT. Similarly, just for sex selection, it is completely banned, especially countries like India. And PGTA for advanced paternal age is also not being indicated, rather it is contraindicated. And various other common conditions like medical or surgical comorbidity predicting OPO pregnancy, all these conditions where you may think that in future it may help in this way or that way. So those conditions we cannot use PGT. So PGT has some specific guidelines where we should use this, where it should not be used, and where we can't use it. That means it is contraindicated. Well, now coming to that, this preimplantation genetic testing which is being performed in the embryo, then whether this embryo should be created through the process of ICSI, intracytoplasmic sperm injection method, or by in vitro fertilization technique. So if you'll see that in the ICSI only one sperm is used to fertilize one egg, where there is chance of any contamination with any other sperms is negligible or nil. But in IVF, what we do, there are so many sperms around the oocyte. Only, of course, the oocyte gets fertilized by only single sperm, but there is chance of contamination of other sperms around it. So while doing the testing, there is chance of contamination of different genetic material. So therefore, there is fallacy of reports can be possible. But still, in the advanced technique at present, even although ICSI embryos are preferred for PGT, but we can also use embryos produced out of IVF. Again, embryos can be day 3 or day 5. You know that while we are transferring the embryo into the uterus, it is either of the both kinds. So if you do a biopsy of a day 3 embryo, there is which is only 6 to 10 cells or 12 cells maximum, where only one cell is picked off, because one cell is being picked off. So chance of getting less DNA material, which may be inadequate for analysis, be there, possibility is there. And poorer representation of the embryo's genetic cells, other cells, and higher test failure chance is there. And if at all there is mosaicism which cannot be detected, because one cell may be normal, another cell may be abnormal, so mosaicism may not be diagnosed. And sometimes because there is less number of cells, by removing one cell, it can cause damage to other cells, thereby it can be detrimental to the health of the embryo. So the embryo may not grow properly in future. If we'll do biopsy in a day 5 embryo, what happens? Where usually it consists of hundreds of cells, out of which only 8 to 10 cells are being picked. So more DNA is achieved, and better representation of the embryo, and lower test failure is there, and less chance of embryo injury is there, and mosaicism chance can be better picked up. So day 5 embryo is preferred over day 3 embryo for preimplantation genetic testing. If we'll see the various methods of trophectodome biopsy or embryo biopsy, so this is for mostly for technical people where they use laser. Laser is something, it will not cause damage to other cells, only those cells. It is done under microscope, and the things are very much calculated so that only very few cells can be picked up, 8 to 10 cells, rest of the cells are not being injured. So this is some safer techniques we are using the method of laser. Sometimes there is some chance, although it is very remote or rare, that it may cause injury to the rest of the embryo cells. Thereby, sometimes it can be detrimental towards the growth of this embryo. And if you'll consider, if you'll ask me whether we should do a fresh biopsy or we should do biopsy in a cryopreserved embryo, because most of the cases what we do, we create the embryo, we do them cryopreservation, again we take them out and thaw them and bring it to the normal condition, take the cells, again we rephrase it, so that it keeps on going. But if you are doing a fresh biopsy, means at the end of the 5th day, if you are just taking out the cells and sending it for the genetic analysis, then you are just subjecting it to the cryopreservation. It is definitely better, because again and again cryopreserving, thawing, this process sometimes damages the embryos. So rebiopsy could be considered only in cases of failed or incomplete or inconclusive genetic diagnosis. So you can also subject them for rebiopsy. But the impact of chi survival and on these the survival rates of the euploid blastocysts, it also becomes a question because of repeated procedures. A terminology is there that is called transport PGT, because this genetic analysis is something very advanced. You need very advanced lab, expensive labs rather, to do this testing. So you cannot have a genetic lab by the side of the IVF center. Even in the same city, you may not get in most of the tier 2 cities. So only few places or only metropolitan cities in India, they have some labs, sophisticated labs where they can do the genetic testing exactly. So what we do, we take out the cells from the embryo by laser technique and preserve it in particular process, cryopreserve it and send them or courier them to the lab, and the lab will take out those cells. They'll do the genetic testing and they'll give the report. So this is called what is transport PGT, that is being followed almost everywhere in India, except you can say in those cities where it is available, they may just shift it to the other center. And there is also a condition called minimally invasive PGT or non-invasive PGT, where, as I told, that these cells are being means removed from the blastocyst by laser. That means we are just doing invasion or doing injury to the cells or the embryos. But in this non-invasive technique or minimal invasive technique, the embryos are not much disturbed or not much injured. So this is how it is being done, because it is also a condition. It is called cell-free embryonic DNA testing. It is usually the spent embryo culture medium in which the embryos are being kept. They may have some cell-free DNA material of that embryo, that is cell-free DNA material, so which can be picked up, or it can be the blastocyst fluid. The blastocyst, it contains a cavity called blastocyst, and the fluid inside it can also be removed, and it can be sent to the lab where it may contain cell-free DNA material, which can be assessed to find out whether this particular type of genetic damage means disease is present or not. In such situations, there is minimal or no damage to the embryo because the embryo is not being handled. No cells are being removed from the embryo. So definitely it's a better technique, but the reproducibility, all the chance of getting a complete report is less. You may not get a complete report because sometimes if you are not getting good amount of cell-free DNA material, then you cannot arrive at conclusion. Well, then how many PGT tested embryos should be transferred? Well, once we have just done the testing of the embryo, then it needs to be transferred. Suppose usually we have a practice of transferring either one or two embryos. Majority of the people go for two embryo transfer. But if you have already tested the embryo and if found this is genetically good, then no need of transferring two embryos. Rather, it is advised that just transfer a single embryo. Single euploid cleavage stage or blastocyst embryo should be transferred irrespective of the age group. So this is usually being, and the advantage is there will be a singleton pregnancy, and we can avoid the complications related to multi-fetal pregnancy. Well, then which kind of means whether a fresh or a frozen ET is good after doing PGT? Of course, as I told, it depends on the setup where we are working, because as I told, only few metropolitan cities are having this facility. So rest of the places, even if they are doing, they have to remove the cells, they have to send them to the labs in the other cities. So they have to cryopreserve the embryos, and you have to, after the report comes, they have to transfer. But in those cities where it is available in the next door, or those IVF labs where they have their own genetic lab, they can do fresh transfer, of course, because if they will just remove the cells on the day 5, and as soon as they get the reports, they can transfer. Even day 5 embryos can be transferred on the day 6 if the genetic report is available by the next day. Well, if you'll see the overall success of transferring these euploid embryos, then people must be thinking that once we do the PGT and we get a euploid or a good embryo, or means genetically good embryo, and we are transferring it, so that we will have 100% chance of getting a child. No. Still, the success of getting a live birth is, or implantation is, up to the range of 65 or maximum 60 to 65%. And so it is not 100% successful in terms of implantation or live birth rate. Well, already I told you that what is mosaic embryo means containing a normal and abnormal genetic condition simultaneously. Then if you are transferring such mosaic embryos, then what will be the result? Whether it should always be discarded or still we can transfer? Yes, many times it has been seen that the embryo has a self-correcting capacity. Even if we are transferring mosaic embryos, the abnormal genetic material sometimes gets corrected by itself and it becomes euploid. So self-correction possibility is there. So you can transfer the genetic means mosaic embryos, especially if there is no healthy embryos available and the mosaicism chances the percentage is lesser, less than you say 15% or like that. If the mosaicism is percentage is lesser, then we can in such situations, if there is no other healthy embryo available, we can transfer that and we can get a healthy child. Well, again, the question, even if we are transferring a genetically good or euploid embryo or after doing PGT, whether still we need to go for pre-implantation genetic testing, because in almost all pregnancies, we usually give option, or we usually suggest or advise the patient to go for some type of pre-implantation genetic testing, especially double marker test. If it find abnormal, we could go for from say coronary sampling or amniocentesis. But yes, if you are doing PGT, whether it is required, question is whether it is required. Yes, because even if we are transferring a good quality embryo which is genetically good as per the report, but we don't know whether still it is having some chance of mosaicism or not. In such situations, if you will not do the testing, we may miss some life-threatening diseases. So yes, it is advocated or it is recommended that you should go for pre-implantation genetic testing as per the recommendation. If you are doing done PGTA, then rather go for simple screening techniques for unemployed. But if you have done PGTM or PGTSR, in such situations, you should always go for coronary sampling or genetic amniocentesis, because in such situations, is mosaic embryo or mosaic fetus is as bad as that having a disease fetus, because those diseases can reappear. So their conditions, it is always advised. Well, just like as we answered the question that whether we should go for means pre-implantation testing or not. Similarly, whether a routine application of PGTA or any kind of PGT testing, or especially PGTA for all embryos should be advocated. The answer will be no. It does not improve pregnancy rate and outcome per stated IVF cycle and or anything. It's not 100%, as I told. Neither it is leads to 100% pregnancy chance, neither it is leads to 100% means no genetic disease condition. So either way, whenever it is actually required or it is indicated in such situations, we should use, and it should not be advocated for all embryo to diagnose the genetic disease in all embryos. So that is the message that I can say. Again, as we have already told, we have discussed the indications, contraindications, how detrimental it is and how good it is. Then whether it is safe. If you are asking me whether it is safer actually for our embryo, for our fetus, then what it will affect the obstetrics, because as such people have so many taboos or confusions or misinformations regarding that IVF child will have this, that, and all. But similarly, if you are going for PGT, whether it is also affecting the pregnancy. So there is, of course, there is no measurable impact on implantation and live birth rates has been shown till date. There is no increased risk of fetal anomalies so far if you compare with the IVF alone. And there is no difference so far as the hypertensive disease of pregnancy, gestational diabetes, preterm labor, premature preterm rupture of membrane, low birth weight babies, or PPS. All these things are concerned. There is no difference if you are compared with the IVF counterpart without PGT. Similarly, there is similar cognitive, psychomotor development. Everything is same as that of the IVF counterparts. So people should not be apprehensive that if you are going for all kinds of genetic testing before transferring the embryo, our fetus may suffer from all these genetic diseases or problems. So this is all about that. I wish to tell you that pre-implantation genetic testing is definitely a big advancement in the science, especially so far as the IVF or X is concerned. and it has its own indications and contraindications, and we should know the limitations and how we should use this, and whatever confusions we have is already I have described that how we should proceed and how we should the knowledge regarding this means science means aspect of the pre-implantation genetic testing should be there with us before we advocate or we take this facility from our center or from any IVF centers. So thank you very much. I hope that to some extent I've been able to clarify the doubts and some of your means informations regarding this technique. So if any questions you want to ask, then you can ask me. Thank you. Is there any question? Okay, so there is a question that is PGT necessary for IVF? Yes, already I have answered the similar kind of scenario or question that it is not recommended for all IVF. So it is sometimes it is optional. People can choose. I told the indications that especially females above the age 35, they can opt for, but it's not compulsory. Similarly, those who have some family preponderance or chance of having some genetic disease in the family, or they have already suffered from repeated miscarriages or IVF failures, those are the people which can opt for PGT. How many embryos are required in PGT testing? Embryos pass PGT testing. How many embryos pass? That means you mean to ask me that how many embryos are actually good in terms of good genetics. Yes, even if we go for 10 embryos, means I will say the percentage of abnormality of abnormality in embryos, maybe 30 to 40% of the embryos are not good or are genetically abnormal, and sometimes it may need to 40 to 50%. So if you are doing PGT of 4 embryos, you may get 2 embryos good, 2 embryos bad, or 3 embryos good, 2 embryos bad. So it is not 100% always. So at least 60 to 50 to 60% pass the testing, if I can guess. Yes. Is pre-implantation genetic testing safe? Definitely anything which is being advocated or recommended for use in human beings or any procedures related to human life is safe, and that's why it is being already being recommended to use. But any procedure which is invasive, still there is some chance of damage or detrimental effect, but it can be negligible or it can be less, for which we are opting this where the benefit is better than the risk. Well, I think there are no more questions available here to answer. Then we can okay, we can stop our Facebook Live for the day. Thank you very much for your kind attention. Thank you.